ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder that typically manifests in childhood and can persist into adulthood. It is characterized by symptoms of inattention, hyperactivity, and impulsivity. These symptoms can vary in intensity and can significantly impact daily functioning and quality of life. What's the history of ADHD? ADHD is not a new phenomenon. Historical records suggest that individuals have exhibited symptoms of ADHD for centuries. The first descriptions of behaviors resembling ADHD can be traced back to the late 18th century. However, it wasn't until the early 20th century that ADHD began to be recognized as a distinct clinical condition. In 1902, Sir George Frederick Still, a British pediatrician, described a group of children who exhibited significant difficulty maintaining attention and controlling their impulses. This early description laid the groundwork for future research into the condition. ADHD is classified into three main types. Number 1, predominantly inattentive presentation, characterized by difficulties sustaining attention, following through on tasks, and organizing activities. Number 2, predominantly hyperactive impulsive presentation, marked by hyperactivity, such as fidgeting, inability to stay seated, and excessive talking, along with impulsivity, such as interrupting others and making hasty decisions. Number 3, combined presentation, a combination of inattentive and hyperactive impulsive symptoms. What then are the causes of ADHD? The exact cause of ADHD is not fully understood, but it is believed to be influenced by a combination of genetic, environmental, and neurological factors. Research suggests that ADHD tends to run in families, indicating a strong genetic component. Environmental factors, such as exposure to lead, prenatal exposure to alcohol or tobacco, and low birth weight, have also been associated with an increased risk of developing ADHD. Is there a cure for ADHD? As of now, there is no cure for ADHD. However, it is a manageable condition, and many individuals with ADHD lead successful and fulfilling lives. The focus of treatment is on managing symptoms to improve daily functioning and quality of life. How is ADHD managed? Number 1, medications. Stimulant medications such as Adderall, Ritalin, and Vyvanse are commonly prescribed to help reduce symptoms of ADHD. These medications can improve focus, attention, and impulse control. ADHD is linked to a deficiency in dopamine transporters, leading to reduced dopamine signaling in areas of the brain responsible for motivation. Stimulants help correct this by increasing dopamine levels, thereby improving attention and reducing impulsivity. Number 2, create a sense of urgency. People with ADHD often perform better when they feel pressure. By artificially creating a sense of urgency, such as by setting strict deadlines or using a timer, tasks can become more manageable and easier to start. The prefrontal cortex, responsible for executive functions like planning and decision-making, is less active in those with ADHD. Urgency can help activate this area, making it easier to focus on tasks. Number 3, change your workspace. Altering your surroundings, such as working in a park, can introduce novelty and make tasks more interesting. Novelty stimulates the brain's reward system, increasing dopamine levels. For people with ADHD, this can counteract the reduced dopamine signaling in the brain, making it easier to stay engaged. Number 4, have a support system or a body double. Engaging in tasks alongside someone else, whether in person or through a virtual connection, can help maintain focus. This technique, known as body doubling, leverages the presence and support of another person to boost accountability and concentration. To bring these facts to life, let's explore some stories of individuals who have navigated ADHD successfully. Michael Phelps, the Olympic swimmer. Michael Phelps, the most decorated Olympian of all time, was diagnosed with ADHD at a young age. Struggling in school and constantly fidgeting, he found solace in swimming. His mother used to say that swimming gave him the outlet he needed to channel his energy positively. Phelps' story highlights the importance of finding a passion and using it to manage ADHD symptoms. Simone Biles, the gymnastics superstar. Simone Biles, an Olympic gold medalist, has also been open about her ADHD diagnosis. Biles has used her platform to advocate for mental health awareness and reduce the stigma around ADHD. ADHD is a complex neurodevelopmental disorder that requires a multifaceted approach to management. While there is no cure, a combination of medication, therapy, lifestyle changes, and support systems can help individuals with ADHD lead successful and fulfilling lives. Understanding and empathy from those around them play a crucial role in their journey. As we continue to research and learn more about ADHD, we move closer to better treatments and support for those affected by this condition. Thank you for joining us. If you enjoyed this video or learned something new about ADHD, please give it a thumbs up, share it with your friends, and subscribe to our channel, Letters of Inspiration. Spreading inspiration one letter at a time. Until next time, stay inspired and take care.